Did you know that one of the most common infections in the world starts in your stomach, and most people don't even know they have it? Let's talk about Helicobacter pylori, or H. pylori, its causes, and how it can be treated both with medicines and lifestyle changes. Causes and treatment of H. pylori. Helicobacter pylori, or H. pylori, is a type of bacteria that infects the stomach lining. It is a spiral-shaped bacterium that can cause a range of digestive problems. H. pylori is found in about 2/3 of the world's population, making it one of the most common chronic bacterial infections. However, many people with H. pylori never develop any symptoms. The infection is typically acquired during childhood, often through contaminated food, water, or direct contact with an infected person's saliva or other bodily fluids. Poor sanitation and crowded living conditions can increase the risk of transmission. Once H. pylori enters the body, it uses its spiral shape to burrow into the protective mucus layer of the stomach. The stomach's acidic environment, which is hostile to most bacteria, provides an ideal home for H. pylori. It produces an enzyme called urease, which converts urea into ammonia. This ammonia neutralizes the stomach acid in the immediate vicinity of the bacterium, allowing it to survive and thrive. This disruption of the stomach's natural defense mechanisms can lead to chronic inflammation of the stomach lining, a condition known as gastritis. Over time, this persistent inflammation can damage the stomach and the first part of the small intestine, the duodenum. This long-term damage is what leads to the more serious health issues associated with H. pylori infection. The most common complication is peptic ulcer disease. These painful sores can develop on the lining of the stomach, gastric ulcers, or the duodenum, duodenal ulcers. Symptoms of peptic ulcers include a burning or gnawing stomach pain, bloating, frequent burping, nausea, and unexplained weight loss. In more severe cases, ulcers can bleed, causing black, tarry stools, or vomiting blood, which requires immediate medical attention. Furthermore, chronic H. pylori infection is the strongest known risk factor for developing certain types of stomach cancer, including gastric adenocarcinoma and malt lymphoma. While the vast majority of infected individuals will not develop cancer, the bacteria's ability to cause chronic inflammation and cellular changes significantly increases the long-term risk. Diagnosing an H. pylori infection is a straightforward process. Several reliable tests are available to confirm the presence of the bacteria. A common non-invasive method is the urea breath test, where a patient drinks a solution containing urea and then breathes into a collection bag. If H. pylori is present, it will break down the urea and carbon dioxide will be detected in the breath sample. Another option is a stool antigen test, which checks for H. pylori proteins in a stool sample. For more direct evidence, an endoscopy may be performed. During this procedure, a doctor inserts a thin, flexible tube with a camera through the mouth to view the stomach lining and take a small tissue sample, or biopsy, for testing. Blood tests can also detect antibodies to H. pylori, but they cannot distinguish between a current and a past infection, making them less useful for confirming active cases. Once diagnosed, the primary goal of treatment is to eradicate the bacteria completely, heal the stomach lining, and prevent the recurrence of ulcers or other complications. The standard pharmacological approach is a combination therapy, often referred to as triple therapy or quadruple therapy. Triple therapy typically involves taking 2 different antibiotics to kill the bacteria, along with a proton pump inhibitor, PPI. PPIs, such as omeprazole or lansoprazole, work by reducing the amount of acid produced by the stomach. This not only helps alleviate symptoms, but also allows the antibiotics to work more effectively and gives the damaged stomach lining a chance to heal. Common antibiotic combinations include clarithromycin and amoxicillin or metronidazole. The course of treatment usually lasts for 10 to 14 days. In recent years, antibiotic resistance has become a growing concern, sometimes making triple therapy ineffective. In such cases, or in areas with high resistance rates, doctors may prescribe quadruple therapy. This regimen usually includes 2 antibiotics, a PPI, and bismuth subsalicylate, the active ingredient in Pepto-Bismol. Bismuth helps to kill the bacteria and protect the stomach lining. It is crucial for patients to complete the full course of medication as prescribed, even if they start to feel better. Stopping treatment early can lead to the infection returning and can contribute to the development of further antibiotic resistance. After treatment, a follow-up test, usually a breath or stool test, is performed to ensure the bacteria have been successfully eradicated. Alongside medical treatment, certain non-pharmacological approaches and lifestyle adjustments can support recovery and help manage symptoms. While no diet can cure an H. pylori infection, some foods may help inhibit the bacteria's growth or soothe the stomach. Probiotics, found in yogurt, kefir, and other fermented foods, can help restore the balance of good bacteria in the gut, potentially reducing the side effects of antibiotics like diarrhea. Some studies suggest that foods rich in sulforaphane, such as broccoli and broccoli sprouts, may have an inhibitory effect on H. pylori. Additionally, green tea, manuka honey, and olive oil have shown some potential antimicrobial properties in laboratory settings. It is also wise to avoid foods and beverages that can irritate the stomach lining, such as spicy foods, alcohol, and caffeine, especially during and immediately after treatment. Managing stress and getting adequate sleep can also support the immune system and overall digestive health during the healing process. H. pylori may sound scary, but with the right treatment, both medical and lifestyle-based, it can be managed and cured. If you have ongoing stomach pain or ulcer symptoms, talk to your healthcare provider. Early treatment protects your stomach and your long-term health.